Hi, good morning. Happy New Year. Thank you guys so much for being here. I'm Alexandra, the brand educator for MDPen. And today I wanted to do a video that could be a quick review of products you can use and treatments you can do to prep your skin and get it in the best shape possible to begin your microneedling series or your radio frequency microneedling series. And these treatments could also be great even for peel prep or something else of that nature. So I hope you as professionals can find this useful. I hope those of you that are microneedling clients or patients can also find this useful. Please feel free to use the chat box. I would love to answer any of your questions. As always, there will be a shopping code for today's video. I'm going to give that to you guys now. It's going to be PREP05. So I don't want to spend too much time going over contraindications for microneedling, but when we do talk about PrEP, it is important that we revisit these things. Hi, Lori. Good morning. You're in my state. Great to see you, Lori. So when it comes to prepping the skin for microneedling, let's just talk about a few things. It's very important that your skin be in good shape prior to treatment. So you don't want it to be compromised. And big things are going to be obviously no sun exposure within 2 weeks, obviously no tanning beds, no sunburns, nothing like this. And the first 2 weeks after treatment, you also, of course, want to know that your patient is not going to be doing any of this or in the sun. Other big things we sometimes forget, no eyebrow waxing, no waxing on the face in general, no depilatory creams, removal, no types of hair removal prior in those 2 weeks prior to treatment. You also don't want to compromise the skin that way. Try to avoid alcohol beforehand. Some people will say 48 hours. Some providers even want you to avoid caffeine if possible. I personally can't do that, but if you can do that, then that's great. Also try to avoid, the same things you would for injectables as far as NSAIDs, Advil, anything that could make you bleed. Of course, there's contraindications that are more on the medical side, so you need to learn those. I'm not going to spend time going over those. Another big one, of course, is going to be Accutane. Some professionals want you to wait a year, get approval from the physician that prescribed the Accutane is my advice. And some may want a year, some may be comfortable with 6 months, but you do need to definitely find that out. Obviously, you don't want to be sweating a lot after the treatment. You want to avoid the gym, things like this. As far as prepping the skin treatment-wise, I see a question already coming in. Is it necessary to have a patch test before microneedling? So I think by patch test, this user means, is it necessary to do a spot treatment? In most cases, no, this is not necessary. Assuming your patient has none of these contraindications that you will go over with them, as well as no risk for keloid scarring, you can go straight into doing the treatment. When it is RF microneedling, you can do a single pass on the cheek. I recommend doing an area with more collagen and then just waiting a couple minutes to see how the skin reacts. And this is done at the time of treatment, after the patient's been numb, everything like that. With regular microneedling, I've never heard of someone doing that. So just so you know, assuming the patient has none of the contraindications, which you will go over. Can I do microneedling if I have a cold sore or other skin infection? No, absolutely not. If you are someone who's prone to cold sores, you can talk to your physician or medical provider about treating prophylactically. They may want to go that route. You may want to go that route if it's something you're used to doing. But even if you do have a random cold sore out of nowhere, whether it's, on your lip, your face, and your nose, you don't want to do the treatment that day. So you will want to reschedule, and absolutely not with other known skin infections. I see a question. Can I wear makeup on the day of my microneedling treatment? No, you don't want to, and you really won't want to. I highly advise doing the treatment at a time and a day where you can just go back indoors and do your thing, whether you work from home or you're doing it at the end of your workday, or if you're doing it on a day off or a weekend, whatever works for you. But you do want to go back inside. You do want to be in the air conditioning. So as far as other things you'll want to avoid, you don't want to apply sunscreen day of treatment. And this rule can vary from office to office. The reason we don't want to apply sunscreen immediately following the treatment is because of the risk of chemical blocks. So if you're using a chemical sunscreen that is chemical and physical, you will not want to apply that. So it's better to wait until the next day to resume sunscreen. This is really one of the only treatments where patients are leaving the office with no sunscreen on their face and need to go home. If your patient is wearing a mask when they come in, provide them with a fresh mask when they leave. If they are someone who wants to wear a mask on the way out, give them a clean mask. How long should I avoid the sun before microneedling? Hopefully I reviewed this. I hope you're always being sun safe, always wearing sunscreen, wearing a hat when you can. But for 2 weeks, you do not want any type of major sun exposure. If the skin is red, sunburned, compromised, tanned in any way, you do not want to do the treatment. And again, guys, this pertains to RF microneedling as well as regular microneedling. I see a question from Lori. I've heard some say no vitamin C serums immediately after microneedling. Is this true? Yes. No vitamin C infused, no vitamin C after. You want to wait about 3 days for the skin to have healed to the point where you can resume vitamin C. I absolutely love antioxidant products. I love our vitamin C brightening serum for MDPen. This is not something you need to discontinue prior to treatment, but it is something that you will wait 3 days to resume. So absolutely, there can be a risk for granulomas as well as many other skin sensitivities. Hi, Michelle. Can you do nanoneedling twice weekly? Technically, yes. I personally have never heard of someone doing it more than once a week, but you could. I mean, you're really going to be helping with product absorption. And as many of you know, with the MDPen refined nanoneedling treatment, there's no numbing required. Nanoneedling is not painful. So if you have the time and that's something you want to do, absolutely. I wouldn't do it more than twice a week just because it can be a form of exfoliation. But I think twice a week would be absolutely fine. Thank you guys so much for all of your participation today. A few things I also want to go over. So treatments you can do before microneedling. If you have a facial device in your office, such as dermal infusion or a form of hydrodermabrasion, whatever the device may be, brand or off-brand, this is a great treatment to do, especially on new patients that are new to you, that have not done a facial in a while. This is a great way to exfoliate their skin, clean it out, infuse serums, get it nice and plump, hydrated. You can do this a week or two before the microneedling series. If they are someone who's prone to a congestion or slightly acne prone, this is also going to help prevent the risk of skin purging post microneedling treatment. So definitely utilize those devices, guys. I know some of them could be expensive. You want to be using them for sure in your office. Every patient should always still be getting nice monthly treatments, nice monthly facials, no matter what the case. So this is also something you can do. If you have patients that are huge fans of dermaplaning treatments, I would not do their dermaplane day of treatment. I get asked this pretty frequently. If someone did that to me, I would have a full-blown rash from the numbing cream, from all kinds of stuff. So to prevent that risk, I would do dermaplane also 1 or 2 weeks prior to that microneedling series, but this can also be a great prep for the skin. I see a new question. What other treatments can be paired with microneedling that will show great results? So there's a lot of things you can pair with microneedling. If you mean day of treatment, this is going to be at your doctor's discretion. If you're using MDPen and you also have a radio frequency facial tightening device such as NDMed, you can definitely do RF first and then do microneedling. Of course, it's much easier if you're just using your radio frequency handpiece first and then doing radio frequency microneedling, but these are going to be great pairings. The other ones are really going to be at your physician's discretion. I have seen people clean out the face or do like a mini facial prior to microneedling, but again, you could be opening things up. You're putting that numbing cream on. Things can be irritating. In my own personal opinion, I like to knock those things out a week or two before treatment because I don't want to oversensitize the skin in any way. Here's a highlight, guys, of things I just said. So talking about MDPen Skincare, if you have a new patient come in, you're with them a month prior to them starting their series, you're doing a facial, you're recommending products. One great thing you can get them on in advance is going to be our Postcare Kit from MDPen. If you have a patient that is on retinol, or any type of vitamin A derivative, tretinoin, retin-A, retinol with an A, retinaldehyde, whatever, they can do this in the month before their treatment. They just want to stop the product about 5 days to a week prior to their series. And being on a vitamin A is a great way to prep the skin. Also, I would highly recommend in advance, if your patient is willing to purchase our human-derived growth factor gel. This is also going to be something that's going to help boost the skin, plump that collagen, get their barrier, get their stratum corneum in a place that is wonderful for treatment. So you could definitely, get them on board with the human-derived growth factor gel, get them using a retinol. If they're not, if you're seeing them far enough in advance, they're definitely going to need our hydrating cleanser post-treatment, as well as our copper HA mist and our pure HA. These are all going to be in the Postcare Kit, guys, besides that retinol, just so you know. So the Postcare Kit is going to be a great thing to sell in advance. Of course, I always recommend bundling skincare with the microneedling series, so you'd also want to do that. The SPF 30 is also going to be present in that Postcare Kit. So these are all important things. But if you're getting your skin in that nice place where it's healthy, it's ready for treatment, this is going to be even more ideal. If you're doing something like a stronger, more advanced peel, you want to make sure you're doing that a month in advance before the microneedling or the RF microneedling. So if it's like an 18% TCA, 20%, something like that, wait a full month before you go in and start needling the skin. Here's that link for the Postcare Kit, guys. And yeah, that's going to be all actives. You do want to stop them about 5 to 7 days before treatment. If you're someone who's more, I guess you rely more on actives, or you have more oily acneic skin, your provider may tell you that, closer to 5 days is okay for you. And depending on the strength of the product, it could be anywhere from 3 to 5 days, to be honest. So just so you know that. This is a technique question. Hi, Michelle. So with MDPen, we do teach a certain method of needling. If you're interested in our training, we'd be happy to train you. We do offer virtual trainings, guys, and in person. And if you do virtual, we can train you even if you don't have our pen, or if you're not in a place where you're ready to purchase our pen yet. But if you do purchase our pen package, that virtual training is going to come with it. So we do have an MDPen way of training that does consist with a combination of what you're asking, vertical, horizontal, diagonal, and some stamping. Again, here's that Postcare link, guys. Provide you with everything you need or your patient needs for post-treatment. Again, you can get them ready in advance if you can start a full-blown regimen. As we move into the spring season too, I'll do more videos on getting, wedding ready or something like that. If someone is getting ready for a big event, ways you can prep their skin in as well. It kind of depends on how early you catch the patient, how early you meet them prior to the event. But same thing goes with microneedling. If you can do, that nice exfoliating infusion, extraction facial, or dermaplane facial in advance before the microneedling, this is going to help them get even better results. And I look forward to doing more videos with you. Bye, guys.